All right, good afternoon, everyone. Michelle Casada here with WPTV, and we're speaking with infectious disease specialist Dr. Larry Bush this afternoon. Dr. Bush, thank you so much for joining us. We've heard the word endemic, the term endemic, over and over again now, and we've alluded to it before in conversations you and I have had about getting to this point. For our viewers who are joining us this afternoon on this discussion, we're talking about COVID-19, the pandemic, and where we are now, if it is turning into now more of an endemic. And of course, as always, feel free to type your comments and questions in the chat there. And Dr. Bush, welcome again. Talk to us. What is an endemic? How is this different from a pandemic?
Sure. Thank you for having me. So there are three terms here. There's the term endemic, then there's epidemic, and there's pandemic. Endemic means a disease that's in the community that's always prevalent to some low number. For instance, there's always influenza in the world, in our country, at some low number that may increase. Epidemic means when there's all of a sudden a large amount of cases of a disease that may or may not have been in the community and rapidly infects many people. A pandemic is when you have an epidemic that spreads not to just one country, but to several countries and therefore several hemispheres. So COVID-19 is not just an epidemic to the United States, it's a pandemic throughout the world. And as of now, we know of almost a half a million worldwide folks who've been infected, 78 million of which have been in the United States.
So we saw that COVID-19 started out as an epidemic in other parts of the world and then quickly became a pandemic. I'm seeing that come to our country. It's been 2 years now. I know people are fatigued about COVID-19. People are tired. Many have gone through the virus. Many have been vaccinated. So what now puts us in the right climate to become an endemic or have COVID-19 become an endemic, I should say?
Well, we know that there have been a large amount of cases, and as people become infected, let's think of the pandemics prior to having any vaccines, going back hundreds of years. They all ended eventually because you create what's called herd immunity, meaning those who are going to get infected become immune, therefore, they cannot infect those who haven't been infected. And that number changes depending on how infectious the virus is. So, in this case, there have been, thanks to the vaccines, which are very effective, we could talk about that, and the fact that so many people in our country and the world have already been infected. Keep in mind the number I gave you, that 78 million Americans are known to have been infected. So we have approximately 330 million Americans living here. Well, 78 million have had a documented test where they went and had a test. But if you or I do a home test and it's positive, it's unlikely we're going to report it to any type of agency or governmental agency. Therefore, the number is greatly undergiven. There's many, many more people in this country who've been infected than 78 million. So therefore, because of that, and because of vaccination, we're reaching herd immunity, where less and less people will become infected.
And that also makes a lot of sense. We saw with the Omicron variant that our COVID cases spiked drastically, November, December, January, and then we saw a huge dip, at least in Florida. I mean, just looking at from the week of January 7th, we had 427,000 cases in the state versus 42,000 cases as of February 11th, last week. So talk a little bit about the cases. I know you said that you have some concerns about getting an actual number of how much spread that we're having in the community, because now those COVID at-home test kits are so readily available too. Will we ever really know now how much spread we have going on?
No, we don't. But the clinical labs, the commercial clinical labs, do what's called surveillance data, and they provide the information estimated by how many tests they get sent from offices or hospitals that are positive. And they estimate that almost a third of Floridians, so there are about 23 million Floridians, so about 8 million Floridians have been infected with COVID already. That's not counting people who've been vaccinated. So a large portion of the state's already been infected or vaccinated. Now we have to keep in mind that as these variants occur, we may come up with strains that the vaccines are not very protective for, but still offer some degree of protection, particularly what they're mostly made to do: avoid people from getting very ill, hospitalized, or dying. Because we all know so many people who've had 3 vaccines, meaning boosters, and they still came down with COVID. But fortunately, it was no more than just a bad flu-like illness, or not even, more like a common cold.
And how do the treatment options that we have for COVID-19 now play a role in this virus, transitioning more into an endemic like the flu that we see every year? We're going to have new strains of the flu. Same thing for COVID-19.
Well, if we have what I call the triad, which is the ability to rapidly identify somebody who's been infected, and that's these home tests that are available. Secondly, a vaccine that is, for all intents and purposes, still very effective at doing what it's meant to do. And now we have oral medications, two of them that are available. And right here in Palm Beach County, there are 10 healthcare district clinics called the Brownback clinics, where you can go and get Paxlovid or Molnupiravir, which are both antiviral medications, just like one would take a drug like Tamiflu for the flu. So, having said that, even if COVID-19 will be endemic, which it likely will be, meaning it's always in the background, we can rapidly diagnose it and treat it, and possibly have yearly vaccines altered to what variant is now available.
Are we seeing an increase in circulation and distribution of the Paxlovid and the other antiviral pill?
Well, unfortunately, the pharmaceutical companies who make them, Pfizer and Merck, have not distributed the amount of medications we need, both here in the US and worldwide. But in Palm Beach County, the healthcare district has gone out of their way to secure the medications from the government, and there are plenty supply at their 10 clinics. And that phone number we can give out, you can call there and obtain the medication.
How does that medication play a huge role in us becoming an endemic? I mean, I know with the flu, for most people, you have the flu, you get diagnosed, you get Tamiflu, you feel better within 2 to 3 days.
Because if we can get people better quickly, they become less transmissible. And on top of the vaccine, also making them less transmissible. And therefore, we have a background amount of COVID, but it doesn't rapidly spread in huge numbers, which we call epidemic. The other thing is it cuts down the chance that the virus will continue to replicate in infected people, and therefore, a chance that it becomes more variable and avoids our immune system or our vaccines.
When we talk about endemic, do you think we're there yet? Are we there? Is this it? Or are we still, do we still have a little bit more to go?
I think we still have to get through the springtime and maybe early summer, because remember, just last week, the positivity rate in Palm Beach County was 6%. But at the end of Delta, we were approaching numbers like 2.5%. In Florida, it was 8% last week. That's compared to almost 30% a few weeks earlier. So the numbers are dropping quickly, but not quite to the number where we can say that the epidemic is over or the pandemic is over. We need to not take our eye off the ball here. We need to continue to do the right things. I'm not saying I'm for mass mandates. I'm saying, use common sense. Let's make common sense a little bit more common than possibly that's occurred in the past.
What is it about spring and summertime you feel that will be telling on what's going to happen with this epidemic?
People are out and about more, and I think as time goes on, unless people are becoming very ill, hospitalized, and dying, they're gonna let down on some of the social distancing that we do. And I'm not saying that we need to, have draconian measures like we were doing before. I'm just saying it's a little bit short sighted to think that you can't become infected just because the numbers are dropping.
Is us staying in an endemic heavily, I guess, influenced by being able to get vaccinated every year? In other words, if we stop getting the booster shots every 6 months or once a year or whatever, however it is for most people, will we see this virus get strong again and come back the way we did in 2020?
If it develops into a variant that really can escape our immune system, natural immunity from prior infection, or if it develops into a variant that can escape our vaccines. If that happens, we can start all over again. And to keep that from happening, we have to cut down the amount of people who can become infected, and that's called herd immunity. The virus can't mutate outside of a living being, whether that's a human or an animal. And we have control over that by vaccines and by rapid diagnosis and treatment and by doing the right epidemiologic things. In other words, preventive medicine. Now, having said that, keep in mind there's been 212 million Americans who've been vaccinated, meaning two doses. There's only been 91 million who've had a booster. And we know that the booster not just cuts down your chance of becoming infected, it cuts down how infectious you are if you do, meaning transmission, and keeps you from getting very ill. So we have to step that up. And already we're hearing about a potential fourth dose. That hasn't been decided yet, but I think that may come in the fall when we have a yearly COVID vaccine, as we do for influenza.
Do you feel we'll start seeing cases go up again if people let their guard down and don't get that third or fourth booster shot?
Yes, because we already know that the Omicron has its own variant called Omicron 2, and that has popped up in parts of the world and has been in the United States. It's very hard to tell how much of that variant there is because routine lab tests don't detect it. That has to be done at the state or the governmental level, the federal government. But having said that, if we have more and more variants that occur because there's more and more disease, even if it's relatively mild, then that can make the numbers go up once again, just like it did with Delta, just like it did with Omicron. I'm not predicting that. I'm just saying that's a possibility if we don't keep doing what we're doing.
Dr. Bush, Barb had a really interesting question. How do you account for people getting COVID twice variants? So we have seen people get infected with one variant and then get infected again months later with a different variant. Will that play any role? My question is, would that play any role in the futures not really being impacted as much by COVID? If you've already been through for several variants, is your body going to protect you more against the next variant?
Yes, because there are common parts of the virus and having the virus before, even if it was a different variant, that your immune system responds to. That's why having had influenza vaccines year in and year out, even if there's a new strain of flu and you don't have a vaccine, or if you do get a vaccine that's not quite a great match, you still have protection from prior disease or from prior vaccines because it cross reacts to some degree.
How will COVID-19 eventually, or will COVID-19 eventually be something similar to the flu?
I believe it will. Keep in mind that our common cold, one third of the common colds that we suffer every year are caused by four coronaviruses. So we've been infected with coronaviruses for as far as we can tell. And four of them make up one third of our common cold. Let's try to make COVID 19 or COVID 20 or COVID 21, or we can even call it COVID 22, another one of those endemic common cold viruses and not one that becomes so severe.
Dr. Bush, all great stuff here. For those people who have been, waiting to get their children vaccinated, I know a lot of moms with kids under 5 years old are pretty disappointed right now. A lot of moms have asked me, what happens if our child is under 5, they haven't been able to get vaccinated, we can't keep them home anymore. Is it safe for them to play with kids who are vaccinated? Is it safe for them to play with other kids who have recently had COVID and already have antibodies? What would you say to that?
I would say that it's safe for your children to play if they're that age and they haven't been vaccinated. Obviously, I wouldn't have them playing with somebody who's actively, infected at the moment. But otherwise, I would go back to normal for that, and hopefully, we'll have a vaccine for those. The reason why the vaccine for the younger children under 5 was held up because there was confusion whether 2 doses would be good enough, which is what we use for other people over 5. And the Pfizer vaccine, it appeared that you really need 3 doses. They were waiting for April to have the final data before asking the FDA to make a decision.
Will we eventually see a booster shot that will last us, for an entire season like we do the flu? We have one shot every year and you're good. Right now with COVID-19, we're seeing the boosters up to 6 months probably are helping us out.
I believe we will. Keep in mind that the flu vaccine used to have 3 strains and now it has 4, 2A's and 2B's. And I think future COVID vaccines, as the years go on, will have more than one strain. And Pfizer and Moderna are already working on adding strains to their previous vaccines.
Any takeaways, Dr. Bush? I know you mentioned that people should be careful and go on their lives as normal, but also not drop their guard. I know you mentioned we're still not at the endemic point yet. What are your final thoughts with that?
One, make sure you've been vaccinated. And when I say vaccinated, I mean 3 vaccines. Number two, if you're immunocompromised, it's recommended that the booster is the fourth vaccine. The primary series is 3 vaccines. The next is don't be afraid of testing if you have even mild symptoms because quarantining yourself, that just means staying away from people closely and wearing your mask. Because the new recommendations are if you wear your mask, you can just stay around people. You should not be afraid to do it and get that test right away. And lastly, let's not get too pessimistic that the vaccines didn't work, because they did work. All the trials, the major outcome of the trial was to keep people from getting severe illness and hospitalization and death. So if we keep doing all these points, we're going to get there. We've gotten there without vaccines throughout the history of humans. We'll get there again more rapidly now with everything that we have at our exposure.
Is there any concern that we're, and I don't want to be what they call Debbie Downer here, but is there any concern that we're one variant away from seeing what we saw back in November, December, just outright, crazy numbers? Or are we a little smarter now? Do we have more treatment options? Are we in a better position to deal with the variants to come?
Exactly. For all those reasons, we have more treatment options, more rapid diagnostic tests available, vaccines that work, and a lot more herd immunity. Like I said, it's estimated that possibly almost a quarter of the country has been infected with Omicron, and that doesn't even include vaccination. So we're getting there, and that's the way we've always gotten there in infectious disease. Let's use the tools at our disposal, or at our hands right now, to make this even more quickly ending.
Wonderful. Thank you, Dr. Bush. So for everyone, our takeaways, we're getting there to the point where COVID will be an endemic, just a virus that we deal with like the flu every year. Still have to take precautions, but we are in a much better situation than we were 2 years ago. And I know a lot of people are fatigued about COVID-19. Many people have already gone about their lives. I see a lot of people out there wearing masks as much as they used to. So just do what you think feels the best and I guess safest, right, for you and your family.
And keep in mind, everybody says follow the science. The concept of safe is not a scientific term. It's a personal feeling. What's safe for one, the other person may not feel safe. So do what you think is safe for you, but trust the science, and the science being the drugs work, the test works, and the vaccine works. Nothing's perfect.
Wonderful. Thank you, Dr. Bush. It's always a pleasure. Thank you all so much for joining us this afternoon. And we'll have much more on this story tonight and on WPTV. Thank you all. Have a great day.